overall function of the circulatory system is to distribute oxygen and nutrients to all cells in our body. There are many components of this system that aid in its overall function. First, the heart is the most important component. It's composed of 4 chambers, the right and left atrium and the right and left ventricles. The heart is key in sending and receiving blood to and from the body. In addition, in order to transport blood, there are many types of blood vessels that are included in the circulatory system. First, arteries, veins, and capillaries. Arteries carry oxygenated blood to all parts of our bodies. Veins carry deoxygenated blood back to the heart, and capillaries are found throughout the body and are the site where veins and arteries meet. Here is where the gas exchange occurs, replacing carbon dioxide with oxygen. There are 2 simultaneous pumps, which send and receive blood to the heart. These include the systemic circulation and the pulmonary circulation. The systemic circulation delivers oxygen and nutrients to organs, tissues, and cells throughout our body. The pulmonary circulation brings oxygen into the bloodstream via the lungs. An overall flow of blood through the body is as follows. First, deoxygenated blood from the right ventricle will pass through the pulmonary artery into the lung, into the capillary bed. Oxygen will then be absorbed into the bloodstream and travel back through the pulmonary vein into the left atrium of the heart and into the left ventricle of the heart. This is what we refer to as the pulmonary circulation. There, we will start the systemic circulation, where the blood will be pumped through the aorta and to the capillaries found all throughout our body, delivering oxygen and nutrients to cells. Then, the newly deoxygenated blood will travel through the vein into the superior and inferior vena cavas and back into the right atrium, thus completing the circulation.
Cardiovascular disease, or heart disease, is defined by the American Heart Association as a condition that develops when a substance called plaque builds up in the walls of the arteries. This buildup narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can block this blood flow, which can cause a heart attack or stroke. Shown in the image above is the difference of a normal artery versus an artery narrowed by the plaque buildup. As you can see, the plaque makes it extremely difficult for the blood to flow through the artery, which can significantly impact the rest of the circulatory process. The role of the arteries are extremely important for heart function because they are in charge of carrying blood away from the heart. However, if this blood cannot be cycled out, it can cause major issues that can result in deadly effects such as heart attacks or strokes.
There are many different causes for many different heart diseases. So for atherosclerosis, the main cause is fatty plaque buildup in the arteries, which inhibits blood flow, and that's all a result from poor diet and no exercise. Another disease is heart arrhythmia, and there's a few different causes for that. There's stress, high blood pressure, diabetes, coronary artery disease, or an electrolyte imbalance in the blood. Another disease is cardiomyopathy, and a few causes for that is tissue damage from previous heart attacks or valve problems or long-term high blood pressure. Some general heart disease symptoms would include chest pain, chest tightness, shortness of breath, or numb or weak limbs. If you have a regular heartbeat, some symptoms for that would be a fluttering heartbeat or a faster or slower heartbeat. You could also experience some dizziness or even faint. If you have some valve issues, symptoms for that would be fatigue, irregular heartbeat, swollen feet or ankles, and again, you could also faint. If you have a heart infection, some symptoms for that would be a little bit different. You would have a dry or persistent cough, you would have a fever, you could have skin rashes, and that would all be accompanied with the general heart disease symptoms. So there are many different forms of treatment for heart disease. The main one would be a lifestyle change, meaning you change your diet and eat healthier. You would also try to exercise at least 30 minutes a day. If the patient was a smoker, they would have to stop smoking as well. And usually that could help a lot of heart disease issues, but if it doesn't, there are medications that people can take in order to relieve symptoms from different heart diseases. And the most drastic form of treatment would be surgery, and obviously there are many different forms of surgery depending on which heart disease one has.
The American Heart Association has issued a scientific statement addressing social factors that influence risk for heart disease. Currently, cardiovascular disease is the leading cause of death in the United States and has the highest rate of cardiovascular disease among high-income countries. There are many factors that can influence the onset of heart disease. but the ones that are focused on the most are the implications that both society and economics have on a person and their heart health. First, I will explain the importance of socioeconomic status. Socioeconomic status typically includes factors like income, education, and employment. Together, these factors can have a big impact on health and risk for chronic disease. Research continues to show that low levels of education and income are associated with increased risk for heart disease. An individual's employment status or occupation can also have an impact on heart health, as higher status occupations may be associated with better health. Also, we must highlight the importance of social factors such as race and ethnicity, social support, culture and language, access to care, and residential environment. These factors are extremely influential when it comes to risk for heart disease and overall mortality. For example, if an individual lives in a dangerous area, they may not feel safe exercising outside, which has a direct impact on overall health. Also, access to consistent and affordable health care is a challenge for many Americans, especially in low-income areas. This is especially troubling because the people that may need it the most will not be able to afford the care they need to get better.
Heart disease and stroke are among the nation's leading killers for both men and women of all racial and ethnic groups in the United States. About 600,000 Americans die annually of heart disease. This accounts for about 25% of all U.S. deaths. To raise awareness for this disease, February has been recognized as the American Heart Month since 1963. Additionally, about 1 in 500 people in the United States inherit hypercholesterolemia, which causes high levels of LDL cholesterol. This is known as bad cholesterol, and this starts beginning at birth. In the future, genetic testing will be used to determine personal risk for heart disease, which may be proven to be useful, but this approach has not yet been tested in the field.
Even at our age as college students, there are still many important precautions to take to prevent the development of cardiovascular disease. Many lifestyle changes can be done to better our health overall. First, due to the fact obesity and diabetes increase your chances of cardiovascular disease, modifying your diet is a great start. Dining halls can have some pretty unhealthy options, as well as you can eat all you want. So, stay away from the french fries and limit your portion sizes. Second, you should increase your daily exercise habits. This can be done by simply walking to class instead of taking other modes of transportation, such as the bus or car. In addition, you should reduce your alcohol consumption and try to manage your stress in a healthier manner. Stress is linked to a lowered immune system and spikes in blood pressure, which can impair our health further down the road. So, try to take study breaks or even meditate to relieve your stress states. Lastly, avoid foods with high cholesterol. For example, maybe pass on the fried food or processed foods that you can find at the markets and replace that with vegetables or fruit.
To conclude, the American Heart Association has many links on how to lead a healthier lifestyle to avoid or decrease the risk of heart disease. To learn more about cardiovascular disease and its symptoms, causes, and treatments, visit the American Heart Association's website at www.heart.org. Also, another way you can receive more information about heart disease is to consult your physician. Thank you.